Hey everyone, thank you for joining us for our webinar today. This is a really great topic and I'm really glad that you could all attend today. I want to just let you know about some resources that the Chamber has to offer right now if you have more questions or looking for info on some COVID topics. So if you go to concordnhchamber.com, we have a COVID webpage, and from there you can get many links to resources, hopefully get a lot of your questions answered, and also see past webinars that we've done and watch the recorded videos of them. This webinar will also be recorded, so afterwards I will send you the video as well as the PowerPoint presentation from our presenters. So you can keep your eye out for that email. A little bit of housekeeping here. If you have a question during the presentation today, you're going to want to submit that through Zoom's Q&A portal. So to access that, you're going to tap your screen or just move your mouse a little bit, and you'll see the Q&A button. And from there, you can simply just type in your question, and it will be seen only by me and our presenters today. We'll try to get to all of the questions that are asked today, so feel free to use that tool to ask questions. That's what we're going to be looking at today. Also, I just want to thank Riverbend Community Mental Health for partnering with us today and sharing this really great information. I'm so glad to have Jaime and Sarah here today as presenters. Thank you guys for coming.
Thank you for having us. Okay, so thank you everybody for joining us for this webinar. It seems that just within the past month, somehow we've become experts in how to work from home and how to keep each other safe. And mental health in the virtual workplace is such an important topic that I feel like I talk about on a daily basis with my staff, and Jaime does as well. So with that, we want to move forward to the introductions for today. Jaime, do you want to talk a little bit about yourself?
Sure. I'm the VP of HR at Riverbend, and I've been here for about 18 years now. Sarah and I joined forces on a lot of different topics related to mental health in the workplace, and now we're kind of working at it from a COVID-related standpoint. So that's what we're working on today.
Mm-hmm. So my name, again, is Sarah Gagnon. I'm the Vice President of Clinical Operations for Riverbend Community Mental Health. I'm a licensed clinical social worker. I've worked at Riverbend for 11 years now, and I've done direct care work, and now I'm doing more administrative work. All right, we can move on to the webinar. So work is important to us for lots of different reasons. Having a work family or even a work identity, I know sometimes when I leave the house and I walk into my office, I feel like I'm a different person. I'm like, okay, here I am not mom, I am the Vice President of Clinical Operations. I have a different identity when I'm at work. Feeling productive and producing results helps us feel like we have a sense of purpose and that we have a mission. Working collaboratively with coworkers, that gives us that social interaction, that feedback that we're constantly looking for. In addition, we're serving people in the community, whether you're a retail shop or a restaurant or you're in healthcare. There's this sense of we are connecting the community together with whatever service that we're providing. And I think most importantly, we're challenging each other and we're challenging oneself. So when you are done with school and you're done getting your degree or you're done the certification or training, you feel like there's more learning to be done when you're at work. Now we are in this, what I like to call the new normal. So on March 16th, I refer to it as D-Day. That's when all the schools closed down. On the 27th, we got the stay-at-home order, and that could potentially be extended to May 15th at this point, and maybe beyond. And that's when everything really started to change for us, and it changed overnight. So now there's this lag in response time that we're not used to, whether that's with communication or feedback or even data that we're trying to analyze. Everything seems to have slowed down, but the need for those things has only increased. We need to take these extra steps to be able to communicate effectively. Jamie and I, our offices are actually right next to each other. And I used to be able to pop into her office, ask her a quick question, see what she's having for lunch, ask her her thoughts about a certain hire. And now it's email Jamie, see if she has time to set up a call. Everything seems to take a little bit more effort. Our purpose of work has shifted. We have gone from, for us, delivering services in the community with people with mental illnesses to how do we keep all of our staff safe from this virus that we're trying to manage as a community. So even though our mission remains the same, there's this added layer of chaos that we're trying to all manage. Results and progress are not immediate. This goes back with that lag in response time. We're looking for, if you're delivering service to somebody in the community, you're used to being able to read their body language to say, oh, okay, maybe I was able to deliver that service well, or maybe there was something I could have done differently. We don't get that immediate gratification anymore. And that's something that I think we're all struggling with. Social distancing, that was the thing that really made things different for us. 6 foot social distancing, needing to wear masks in public places, all of that made our work very, very different. And it continues to challenge us when we're so used to having those face-to-face encounters with people. And despite all of this, productivity requirements remain the same. We still need to have a bottom line. We always say that there's no mission without a margin. And we need to make sure that we have all the funding in place to continue the businesses that we have that are so important. And in order to do that, a lot of people are working from home. I'm working from home today. I can hear my 5-year-old in the kitchen trying to figure out lunch and Legos right now. It's really challenging. Everything between cats walking across keyboards and trying to shush little ones in the corner, everything feels different. And that work identity and that work family that we rely so much on isn't there for us the way that they were before. So how do we keep it all in check? The work-life balance is at the center of our lives now. And before, they were always maybe assumptions that people were working on their work-life balance, or it was a passing conversation. Certainly with millennials, it was something that was really important, and it came to us when we were starting to hire people, like, oh, this is very important. How can we continue to make this a primary focus of the day at work? And now, work-life balance is everything that we're trying to figure out right now. How do we balance taking care of ourselves, making sure that we're safe, making sure our family's safe, and we're able to actually connect with people at work again? So in my opinion, this really has brought us back to basics. How do we communicate effectively with one another? How do you take care of yourself? What are some of the things that are important to you to do? And let me share with you what's important for me. To me, this has helped us appreciate all those little things that maybe are really difficult to see right now in this challenging environment. I know for myself, I have gathered at least probably an hour and a half more of time during the day, just from not commuting and dropping kids off at school and daycare. So even though things are pretty chaotic, there are little things that you can appreciate and encourage others to look for as well. There are also some good habits that we have started to focus on that now that we're working from home. Being able to look around the house and say, oh, this area probably, as I set up my work office, how can I make this feel comfortable and relaxing for me while I'm trying to work and balance everything at the same time? And self-talk and self-coaching is really important. And we do it all the time, but not a lot of people say that they're doing it. So positive self-talk and self-coaching sounds a little bit something like, I have a 1 o'clock meeting today. I'm nervous about it, but I know I can get through it, and it's going to be done within an hour. And then after that, I'm able to pick up the phone and say, whew, glad that one's over with. I'm not talking about the webinar at all, though, today. This is something that it's important that we're talking to ourselves and giving ourselves positive reinforcement. It's also really important that we share signs of hope. We don't know when this is going to end. They are saying that sometimes, you know, the stay-at-home order could be May 15th, or this also could be going on for 12 or 18 months. We really don't know. But it's very, very important to share hope, share positive feedback with one another so people know that they're doing a good job and how they feel is important to you. And it's important for you to be able to share how you're feeling in this current environment as well. So giving staff guidance. So staff are looking for direction and answers now than ever before. And it's important to take more of a directive approach versus delegating. So for people that we work with that have more experience in the old environment, we're feeling a little bit more comfortable with saying, here you go, Jaime, why don't you take this project? I have full confidence that you'd be able to handle that. Well, maybe Jaime doesn't know how to handle that project working from home. And she has a lot of questions and answers, and maybe the level of confidence that she previously had has decreased a little bit. So it's important to say, okay, Jaime, here's the project that we need to work on together. These are the steps that are the priority in the project. How can we work on this together? And here are the things that I think that you can do solo, but if you need help, make sure that you're bouncing those questions off from me. Don't assume that your staff know what they need to do. They need constant reassurance at this point. Reassurance that they're doing the right thing, reassurance that we care about how they're doing at home and what their safety is like and how they're feeling emotionally and physically. It's really okay to not know the answer because no one does at this point. There's lots of research out there about working from home, making sure that you're keeping your mental health check when you're at home, but this is all very, very new to us. I was recently doing some research about how to anticipate a mental health surge, an increased need of mental health after something like a pandemic. And the closest I came to it was looking at information post-recession. And we found that people that were working and insured needed 4 times more mental health support than they did previously a year after the recession. That's only for income insecurity. Never mind income insecurity, plus potentially having loved ones that are sick from COVID. So it's a scary world out there, but being able to support each other is the very best thing that we can do. Have resources available to share with your staff. Jaime and I have put together some resources at the end of the PowerPoint that we can go through with you, but not knowing the answer is okay, but it's also important to say, I don't know the answer to that question right now, but I know how to find the answer, or I know who to ask. It's really also important to be trying to pay attention to your staff's morale and to be boosting morale by sharing coaching strategies. And what I mean by coaching strategies is a little bit like that positive self-talk and self-coaching that I was mentioning before, but being able to say, I know that this is going to be a tough day. I know that this is new for you. Tell me what you need for support to be able to help you get through that. And we'll be able to do it together. And I'm going to check in afterwards as well. I saw this online and I just loved it. Introverts, check on your extroverts because they are not okay. Next slide, Jaime. So people really miss other people. I've been hearing that a lot from our clinical teams. Riverbend has a staff of over 100 people that are, 400 people, I'm sorry, that are used to seeing each other all the time. And what I've been hearing is people really miss seeing their coworkers, never mind their family and their friends. Zoom is okay, but it doesn't give you that social interaction that humans are always looking for. Don't assume that everyone is okay. Check in frequently. I've been checking in so much that people are like, Sarah, please. You've been texting, you've been calling, I'm okay. But again, don't assume that everyone is okay because that one person that you haven't checked on maybe isn't doing great right now. identify ways to improve communication and connectedness. You know, it was something that was interesting in talking about like millennials are able to communicate in such a different way than most of us are used to. Whether it's texting, social media, they've really become the experts in figuring out how to communicate more effectively in this new environment. So I was in a meeting just earlier today where we're talking about different platforms to use for therapy or for meetings. And we're saying to ourselves, like, we feel like we're working really hard trying to identify these things when there's people out there that know all of this stuff really easily. And those are the people that are the millennials and the younger generation. Little things like hosting a lunch hour on Zoom or setting up staff meetings on Zoom, telling people to turn on your camera so we can see each other's faces, see each other's mannerisms. Those types of things are really important to people right now. And promoting wellness and self-care. So while we're having these Zoom meetings and lunch dates, say, hey, how are you taking care of yourself? How are you holding up? That's a great idea. Maybe I'll try to do that too. Let me share with you some of the things that I'm doing as well. Validation and normalizing. To be able to say, wow, that's really, really difficult that you're going through that right now. And a lot of us are sharing that same stress. How can we pool our resources together to be able to support each other? Because we are all in this together. The air high five from The Office. I thought that that was pretty spot on for today. So communication is key. Don't assume that staff know what's going on a daily basis, because they probably don't. People not only want to know what's going on within their team or at work, but also what's going on in their community. What's it like at the local hospital? How many people are sick in our community right now? Can we have a conversation about that? It's important to triple your efforts. That sounds like a lot of work, but a supervisor that I once had used to say that in order to get your message across effectively, you need to say your message 13 times in 13 different ways. That sounds a little bit like of an overkill, but it is important to make sure that you're communicating multiple times. Jaime and I were just before this webinar on a meeting with over 60 people on Zoom talking about communication and how the message from the manager was having a really difficult time getting down to the direct line staff. Even though we've had daily emails, weekly emails, we've tried to make sure that communication is as thorough as possible, there's still going to be gaps. So it's important that you do everything you can to be able to communicate effectively. Use multiple venues and platforms to get your message across. Text, email, call, do it on Zoom, whatever it is that you need to do, make sure that if it's a really, really important message, like telling people they need to do 6-foot distancing and using masks for their safety, that you are communicating to the point where you know for sure that they've heard you, and ask for that feedback. Say, okay, we just had a really important conversation. What kind of questions do you have for me? And can you actually tell me what some of the important points were that you took away from that?
All right. I have that 13 time thing in my presentation part too, Sarah. So getting into some of the HR side, messaging with employees, I tried to pick on some things that I thought were going to be helpful for folks. Messaging with employees on an intranet. Most intranets tend to be internal. And what we found in this environment is that we've had to move a lot of people remote really, really quickly. So we moved our intranet externally to the internet and added a secure portal to it. So now it's password protected, but we were able to make it so that people could access it even without a virtual portal. You know, they could access our intranet from wherever they had internet access. And that way we could keep communication flow around COVID resources and whatnot, all still accessible for people regardless of where they were making their office from that particular day. And that's been a really helpful form of communication. We tried to keep, since we're in healthcare, we've had a lot of information about what types of personal protective equipment to use in what situations, and cloth masks and surgical masks and that kind of thing. And having all of that in one spot, date ordered, has been very, very helpful. So the intranet has been really good. We also have some great photos of masks and everyone wearing their masks and all the different great cloth masks that people have and all the different fabric designs, and office hockey, socially distanced office hockey I've seen. And there was a really good photo of me holding a giant stuffed monkey one day when I was on the phone for a really, really long time that someone snapped as they walked by my office, because I can't hug anybody else, so why not hold a giant stuffed animal? So, you just have to use your intranet for things to communicate with people, for real things and for fun things too. When I think about employee assistance programs, I know that our EAP has been with Anthem, but there's a lot of EAPs out there that have been promoting a ton of different tools. And I know that ours has had mindfulness workshops. They've been doing yoga, virtual yoga. We've had all kinds of offers for phone support that they've been promoting. They've been pushing out a lot of email blasts and web blasts that we could put out to people as reminders for extra support. And then different information with articles that we've been pushing out to people, and also reminders about the legal, financial, daycare, and all the typical things that EAPs help with as well. So just kind of pushing out those extra things in lots of different ways, through the intranet, through email, by text, whatever platforms you use. Those are all really important to push out to folks. When it comes to health benefits, I think promoting things right now that may be lesser known to people, especially during this time of staying at home and trying to be more distant from providers and public spaces, things like mail order prescriptions are a really good benefit to promote, where people can get a 90-day fill instead of going to their local pharmacy. Some local pharmacies and benefit plans are even offering to do a 90 order. So those are things you could promote. Telehealth benefits, excellent option for people. A lot of telehealth platforms can be downloaded on phones or on tablets. They're very, very easy to use. You can use them from anywhere, and it definitely will save you a trip and certainly keep you distant from, any public interaction. I think about urgent care sites and the different options people have with using something like a minute clinic versus a convenient MD versus a hospital-based urgent care versus an ER, and what those different things mean. So communicating different information about your benefits and all of those things that might be really important for folks right now. The changes recently around the CARES Act and the Families First Coronavirus Response Act, they recently made some changes to flex accounts. So if you haven't seen those yet, some folks may have seen those from their brokers or their flex providers. But over-the-counter medications are now included, as well as feminine hygiene products. So those are things that can be helpful to your employees who have flex accounts, because those are new things that can be bought on a pre-tax basis using those funds. And there were plan changes that were available to 401k and 403b plans that allowed for different options around withdrawals and loans if plans did certain things under the CARES Act. So if you haven't read about those things are things that you can potentially look into for your employees as options. With COVID testing, I wanted to mention here that a lot of, I think most health insurance carriers are waiving certain fees, co-pays, and whatnot for testing and treatment of COVID. So that's been important to relay to staff. I've also tried really hard to put everything around this in layman's terms to the best of my ability, because a lot of staff don't understand some of the more complicated terminology around this. And there are a lot of testing sites around New Hampshire that people can go to even if they are not connected to a PCP. Initially, there were a lot of issues where people had to get a PCP test, like an order slip, in order to get tested. And there are places around, I think there are 11 convenient MD sites throughout New Hampshire. There's a triage phone number. I actually have it at the end of the PowerPoint, where around you could just go there and contact them through the phone number and they would schedule for testing, and you do not need a PCP referral for that. So there are good options out there. Wellness activities that can be done virtually or in the office. The hockey one that I talked about, where people were scooting around on their office chairs 6 feet apart, playing with garbage cans and I don't know what all else in their office. We did river bingo virtually with all kinds of virtual things where people were playing bingo week to week for different prizes, like getting dressed was a bingo box, I think. And oh, Sarah, help me out. What were some of the other things on there? Reorganizing your home office.
Mm-hmm. Yeah, there's a lot of self-care boxes.
Yeah, it was a lot of self-care. Going for a walk, I think, was one of them.
Mm-hmm.
I mean, getting dressed was the easy one.
Right.
I forget what all else was on there, but like doing 30 minutes of exercise, I think, and, you know, things like that. But they were mostly self-care initiatives. Things that are around morale boosting contests and activities. Coloring contests have been pretty popular. I've seen those a lot with different places. And encouraging people to take breaks. That's a really interesting one because it really could go one of three ways. If I think about it, we have folks who are sort of our traditional workers. They do the 8 to 5 thing. They take a morning break, they take a lunch break, they take an afternoon break, they punch out at 5 and they're done. So they're, you know, doing their thing and they're going home. And then there are maybe our underachievers who are taking a lot of breaks. You know, they're working some and they're taking a lot of breaks and they're, you know, really taking advantage of whatever flexibility that they may have. And then there are the complete opposite. They're the overachievers that are working through their breaks and through their lunches, and they are not punching out and they are not taking breaks and they're not practicing good self-care. And there really needs to be a good balance there. And the message really should be the same for everybody. We expect that people are going to put in the effort to do their jobs to their fullest potential. We expect folks to be busy to whatever that means for our business, but they need to take breaks during the day, just like they would if they were in the office and it was pre-COVID. If they are normally taking a 15-minute break in the morning, they should be doing that at home. If they're normally taking an hour lunch, they should be doing that at home. Things, just because they're at home doesn't really mean that things should be all that much different than when they were in the office. They still need to be practicing those same concepts. Let's see. I think it's really important to lean on your HR peers for support. I often refer to this as HR therapy. Think about your HR chapters. In Concord, we have the local Human Resource Association of Greater Concord. We have LaborNet, which is run by, it's like the email blog, I guess, for lack of a better term, through She and Finney, which is a really good resource to throw questions out and just get input from folks that are all over the state. Reach out to your HR colleagues or mentors or your legal counsel. There's a lot of things being thrown at us right now. There's all kinds of new regulations and guidance, and it's really, really hard to take it all in and digest it all and interpret it all and roll it all out without being confused. I mean, I'm confused every single day. So it's really important to be able to rely on your people. Like, we're all here for each other. Even if you are the HR person, the accountant, and the president, you still need to have some people to rely on to ask questions of, because we're all in this together. Mm-hmm. Think about how you can nurture your culture. because it's so important and it's equally challenging. There's a lot of ways that you could do it. I think the main ways that I think of around this are communication with folks, especially around your mission, your vision, and your values, and your organization, and how you're all working toward the same goal, making sure everybody's kind of rowing the boat in the same direction. Having fun, that can mean a lot of different things, but kind of working with your group and showing them that you're all trying to have fun too, even though you're all there to do a job. Showing your staff that you truly care about them as individuals and really mean that you do. I know that here I send birthday emails to people. We have 420 some odd staff. Well, I keep tabs on when everybody's birthday is, and I send them an email on their birthday to let them know that I recognize that it's their birthday and I hope they have a great day. And it's true, I do. And we send cards out when people are having a baby, or if I find out they're getting married or whatever. I keep cards in my office and we send cards to people. It's just really important to recognize those things and take the time to make those moments special for people. Find ways to check in with people from the HR perspective to see how it's going. And if you're a small company, it's going to look different than if you're a big company. Around here at 400 and something people, it's tricky, for me to be able to check in with people. Some things that we've done are what we call post-orientation interviews. I like to check in with folks or someone else from HR maybe 3 to 6 months after they start with a phone call or an in-person meeting, whatever's more convenient, just to say, hey, how's it going? How was your training? Do you have everything you need? Is your desk set up ergonomically? How's your supervision going? Is your computer work okay? How's things? And then, do you do listening sessions? Do you do town halls? Do you do engagement surveys? Do you drop in on team meetings? What do you do to stay connected to your folks? The bigger you are, the more challenging this is, and it's going to be tricky to figure out how to connect with your people. But there's lots of different ways to do it, and it's just one of those things that's really, really important. And then finding ways to acknowledge people for good work. There's so much great work going on out there, and there's lots of really cool ways to acknowledge people, and it doesn't always need to be in a super public forum. You don't need to do an ad on WMUR, but it could just be a simple post-it note that you leave on someone's monitor, like a quick note saying, hey, great job today, something like that. It could be a peanut butter cup that you leave on their keyboard. It could be a postcard that you mail out to them. I mean, could be anything, but just really making time to take 2 seconds to do a quick recognition, whether it's a public or private thing, or maybe some combination. I think all of those are really important. Training. We spend a lot of time doing training here, and I imagine that looks very different in lots of organizations, but it's going to be very important to think about what training is going to look like in your organization going forward. And it's probably going to need to convert to a virtual platform, at least for the next several months, if not going forward for more years to come. So think about how that might look for you and what things might you need to implement in your organization to make that possible. And the same goes for onboarding. How is that done now? And how might you need to adjust it in the future to onboard folks once we figure out what our new normal might really be, since we don't necessarily know what that is. And then, I don't know about you, my crystal ball's in the shop. I put a little picture here of what it looks like. But I think that we're probably going to be in a place where remote work is here to stay. People, I know at Riverbend, we haven't had a lot of folks who work remotely before this. There were a few who had remote type positions, but for the most part, most of us worked in the office. But I do think that now that we have figured out how to do some things remotely, there will be an expectation from people that we continue to do that on a go forward basis in some way, shape, or form. And I imagine for other industries, that's going to be the same. So we're going to have to figure out how to make that work on a go forward basis and whatever that looks like in our businesses. We need to start thinking about recruitment and retention needs post COVID now. It's going to be tricky to figure this out because we're looking like a recession right now. We have a ton of people who are either unemployed or underemployed who are currently collecting unemployment. When that federal boost of unemployment, that $600 benefit ends, if it'll be extended, if it won't, that's going to change the amount of people that are seeking work, potentially on a moment's notice at the end of July. We could be suddenly flooded with applicants or maybe not. It's really hard to know, but we need to think about how we're going to try to fill our open positions and what our open positions are going to look like based on our anticipated business needs. Are we going to need temps? Are we going to need contractors? Are we going to do direct hires? Some combination? Maybe we need to start lining people up now, make those relationships. What do we need to do to start planning? And I don't know about you, but our employee handbook has not been done in a few years. And it's one of those projects that I try to put off because it's not something you want to do on an every year basis. But I'm pretty sure it's going to need an overhaul by the time that a few more months passes. There's going to need to be some adjustments in there for remote working. There's going to need to be things in there around contagious disease policies and all kinds of stuff that has happened in the last couple of years. So I would say if you haven't thought about it already, you're probably going to need to ponder an employee handbook overhaul in the near future. And then prepare for virtual training and e-onboarding. I think it's going to be the norm going forward. So we're going to have to figure that out. Things like e-signatures and e-documents and how that's going to function in your world, making sure that that happens in an electronic way. So these are 3 resources that I thought of. I mentioned the COVID testing hotline with Convenient MD. I know that the governor has spoke about the 11 testing sites around the state. I know there's one in Concord. I think he mentioned Bedford, Merrimack, Littleton, and a bunch of others. But that is the phone number that is available. And then the list of all of the Convenient MD sites in New England are at that link. The HRA in Greater Concord is the local chapter for human resource professionals. So that's the link for the membership for that group. And then the LaborNet discussion group through She and Finney to join that is the link for membership there. And then Sarah, you put some resources here if you want to talk about what those are. Oh, you're muted.
Sorry about that. So this first one is actually from LinkedIn, and it has several like 15 to half-hour quick little videos about working from home, productivity tips, time management, the work-life balance. I found those to be really helpful in even preparing for this webinar today. The next one is NAMI, newhampshire.org, and NAMI stands for the National Alliance for Mental Illness, and this is our New Hampshire chapter. So in their website, there's a whole section just on COVID, and there's multiple yoga from home, support groups from home, lots of different things that you can access via Zoom just by logging in. Some of them are previously recorded, some of them are live, but there are a lot of mental health supports that you can access through NAMI. The next is the World Health Organization. This one was this article specific to the coronavirus and mental health considerations because of it. I thought that was a really interesting document, but the World Health Organization in general has lots of different things and articles that you can be reading on. The other thing that we have found really important at Riverbend is to stay up to date on the CDC numbers and guidelines. That has really been what has guided Riverbend Incident Command in how to give staff the latest and greatest news about staff safety, if the numbers are plateauing, if we've been successful with flattening the curve, or if this is a time to worry. So that's the type of information that's been really helpful. Something else that I didn't put on here that I should have was Concord Hospital's website. So I'm friends with Concord Hospital on Facebook, and they post regularly how many cases have come through the hospital, and out of those cases, how many are being managed outpatient versus inpatient. And those numbers, even though this is a really scary time, I see that there's 60 cases, but 6 of them are in the hospital and everything else is being dealt with outpatient. That made me feel a little bit better. So that type of information is really important to share with your staff as well, even if it's just to have a conversation about it.
Yeah. You know, and I didn't mention this either, but I was just thinking that generally speaking, 1 in 5 individuals has a diagnosable mental health condition in their lifetime. And being involved in a situation like we're currently in is very isolating. So this type of situation is only going to exacerbate those types of symptoms. So on the flip side of this, we're probably going to see a surge of people seeking treatment. It may not be right away that we see it. I think Sarah mentioned that sometimes it might be a year later, and it's folks who may be income insecurity driven into treatment because of insurance related issues or loss of job types of things. But there's so many other components around mental health that can get stirred up with situations like this. Between fear and anxiety, isolation leads to depression and all of that. And with children being away from their normal routines, there's a lot of maybe attachment type things that we could see coming out of this. I don't know. I mean, I'm not a clinical person, but just having kids out of routine in general in the summertime tends to lead to more referrals to our children's program in the fall. So having kids out of school in March all the way through the whole school year and then all the way through summer and then maybe going back in the fall is just going to potentially be an issue for them as well. So I just think it's worth noting that the mental health centers in New Hampshire, there are 10 of them. All 10 of us are open for business. Our services may look different. We're not necessarily going to say, hey, walk in and we'll see you in person for therapy. It might be through telehealth or telephone or some other type of service, but all of those services are available, just like your EAP services are available. And it's there to benefit our community, and that's what we're here for.
The only thing I would add to that is to make sure that everyone's trying to be proactive as possible. So that means that those little check-ins that I was talking about before, asking people how they're doing, and that one employee says, you know, I'm having a really hard time. I'm sleeping, I feel like I could sleep all the time. I have no motivation. My productivity has been way down. That's when you tell somebody, hey, you know, maybe it's time for you to call the EAP, or maybe it's time for you to go see your primary care physician. Have you talked to anybody else about this? That proactive approach and following up with that, even though I know these are difficult conversations to have, but that can prevent somebody from getting to a place where they're severely depressed. Because this is the type of community crisis that can cause depression, it can cause trauma, it can cause anxiety. And being as proactive as possible, like I said before, it's okay to not have the answer, but you got to have the resources, and you have to be able to say, I'm so sorry that you're feeling that way. I'm going to do everything I can to get you some phone numbers of people to call if you're having a difficult time. So with that, we'd like to open it up to questions on the Q&A board. I know that Emily has some questions that we're going to do our best to answer.
I do. I just saw one submitted though,
Oh.
so if you want to take a look at that. Just a reminder for everyone, if you have a question today, that's fantastic. You'll want to submit that through the Q&A portal. So wiggle your mouse a little bit and that'll pop up and you can type it in.
Sure. So we have a very serious question about, have you seen an increase in child abuse, domestic violence, substance abuse, or suicide cases because of kids being out of school? And what is Riverbend doing to address this? So this is a really scary thing for us. We talk about it a lot because DCYF calls are down by over half in the state. So that means that kids aren't going to school, they're not going to their therapy appointment, they're not having that face-to-face interaction with the people that would be calling DCYF because they're noticing something. This is something that we're really, really afraid of. So what we've done is we've expanded access for the children's program. Historically, what we've done is we've made sure that we have all the consents in place from all the legal guardians in order to do an intake for a child. And now we are working on that after the intake. So we have opened the doors to make intakes and access to treatment as quick and painless as possible. People can call and get an appointment with a clinician. And then afterwards, we talk about the paperwork component of it. But right now, the HIPAA regulations federally have been lifted. So HIPAA is something that we certainly want to be paying attention to, but we're not restricted by HIPAA in terms of using telehealth and video. So we're able to explore different platforms that maybe aren't HIPAA compliant, but it's the fastest way for us to get services to the neediest people right now. So that's something that we've been working on. The other thing is that being able to make sure that consents are happening from the legal guardians for treatment, that can actually be accepted verbally in this new environment. So we push out paperwork via email or through snail mail to have people sign it and send it back. But we are doing everything we can to make it as easy as possible so that there's no hoops to jump through whatsoever.
All right, so I have a question here for you too. You talked about checking in with employees frequently, which I think is, a really good tactic. But for some people, they only get checked in on if something is wrong. Do you think that people are nervous to suddenly get checked on frequently, and is that adding to their anxiety? And is there something that you can do to mitigate that?
That's a great question. So in the mental health field, regular supervision is something that happens on a weekly basis, and it's just a given. We are working with really difficult cases, we're making difficult clinical decisions, so we want people to be talking to their supervisors and managers about that. If you're not used to doing that, if that's not your normal, the way to make it your new normal is to have a conversation about it. To send out an email and say, hey, heads up, I want to be the best manager I can be and be as proactive as possible. So I'm going to text you, or I'm going to send emails. I'm going to give you a call to make sure that things are okay. This is different than what we would typically do when we would just pass each other in the hallway and give each other a thumbs up or a high five. This is me purposefully checking in with you to make sure you're okay. So to communicate that message will really help people understand what the purpose of it is.
I think that's really good advice. You answered this a little bit previously, but if you check in on someone and they answer, I'm not doing well, like you spoke about before, do you have tips for having that kind of conversation and, directing people to services if they need that, or just navigating that? Because this is really new for a lot of people, and a lot of people are thinking about mental health in a new way right now.
Sure. I mean, I can't think of anything scarier than when I was, doing direct care work and I asked somebody that question of, have you ever thought about hurting yourself? And you're scared of the answer, because if they say yes, and I am thinking that right now, how are you going to respond? So in a world where people are checking in with their supervisees or with their employees, and somebody says, Sarah, I'm really glad you asked because I'm not doing okay. And then what do you do? So again, it's really important to have resources at your fingertips, even if it's HR, even if it's an EAP, or just to know Riverbend's emergency phone number, which we'll make sure it gets emailed out to this group. So Basic information like that is where you can start. But how you respond, you don't want to say, oh man, that really stinks. Jeez. What you want to say is, I'm so glad you told me that. I want to be able to check in with you more about this, and I'm going to get you a bunch of resources. If you have a hard time going through those, let me know, and we can work with HR, we can work with an EAP to get you any type of resources that you need. Everything from online yoga to an emergency services phone number, we can get you resources. And that's what people want to hear when they say, I'm not doing well. They want to hear, wow, I'm glad you told me that positive reinforcement right away, and ... we can get you the help that you need.
Yeah. That's really good advice, because I think it must take a lot of bravery to, tell your employer that you're not doing well. That's huge.
Absolutely.
Yeah. Can you talk a little bit?
Can I just pop in from an HR perspective too? When people are contacting you about something that's going on in their lives, as an HR person, if someone calls me and says, Jaime, I need to take time off because I'm having a hip replacement, my reaction should be the same if they're calling me to say, Jaime, I'm taking time off because I'm going into detox. Or Jaime, I'm taking time off because I'm being admitted to the inpatient unit for my depression. My reaction should be absolutely the same for all of those things. Please, thank you for calling me. I'm sorry to hear that you're, having a hard time right now. What can I do to be supportive for you? Let me get you some information about FMLA or the disability benefits or whatever the case may be. But it really should be the same type of support. The reaction should be the same.
Thank you. With teletherapy being a resource that people can use if they're struggling right now, can you guys explain what that looks like for people who've maybe never tried it before?
Sure. So it's really exciting that we're able to offer this. So if somebody calls the main Riverbend phone number, you'll be able to talk to one of our admissions specialists that will collect some basic information. And then to get an intake appointment, we'll collect your email address and send you a link. All you have to do is click on that link, and then you'll see a clinician like me on the other end who will talk briefly about informed consent. Are you okay with getting your services delivered over video? Let's talk about any technology problems that you might have. If all of a sudden your Zoom blocks out, here's my phone number, or let me get your phone number so I can call you so we can make sure that we can stay connected. But basically, it feels a lot like this. It feels kind of funny, especially since we want to be face-to-face with people. But you're able to read people's body language. You're able to give some really affirming messages just by being over video. And it feels funny at first, but I have to tell you, it's been really effective for our clients.
That's good to hear. I have some friends who take advantage of teletherapy, and they have found it to be, really wonderful. So I've heard only good things about it.
Great.
So with people under a lot of stress right now, I'm sure that there's more conflict internally with businesses, just like conflict among staff members. And how do you manage that when you are a manager and you're remote?
That's a really great question. Jaime, do you want to field that, or do you want me to start?
Wow, that is a good one. There's a lot of really challenging things that we as managers have had to figure out how to do from afar. Things like terminating employment via Zoom, or doing a layoff via Zoom, or a performance corrective action plan remotely. All of those things are not things I would like to do away from someone. I would much rather have that conversation in person. But we've had to try to figure out how to do that in this kind of unusual atmosphere. And I'm telling you, I am a people person. That's why I'm in HR. It is really, really tough to have conversations like that over a computer screen. So it has been really, really hard to figure those things out. And I have to say that there is no rule book for it. I think that you have to sort of tailor your approach to the group that you know that you're going to be working with and try to navigate it to the best that you can, knowing who your cast of characters is. I don't know that there's a one size fits all for that. I think it's going to be very business specific. I think it's going to be very team specific. And you're really going to have to look at the group of people, or maybe just the one or two individuals that are involved, and really kind of figure out how best to address it given the technology and the players that you have in the game, because there really is no perfect approach. I don't know, Sarah, if you have anything you want to toss in there.
Yeah, I think I want to add the part about having multiple platforms and venues for communication, because if you want to make sure, if you're like a director, let's say, that your middle manager has all the tools they need to be able to resolve the conflict effectively. You don't want them texting back and forth on a group text with problem employees to try to figure it out. And again, we can't assume that everybody has the tools or knows what to do. So you want to take that more directive approach to say, we're having a problem with 2 employees, even in this environment right now. What we're going to do is send out emails to them to say, this is how it's going to be addressed. There will be a Zoom meeting that we want you all to be invited to at this time, and being very prescriptive with exactly how it's going to be addressed so everyone is on the same page.
That's comforting to know that, Jaime, even, you're learning things and seeing how things are like, they're really a challenge right now. Yeah.
There is no rule book.
Makes everyone feel a little better that they're not alone on that.
So
Yeah.
true.
So this is a question kind of for thinking down the road. But when businesses start to reopen that maybe aren't essential right now, I can definitely see that there may be a lot of employees that are actually really scared to come into work. And even though employers may, have new policies about face masks or social distancing or, whatever might be appropriate for their business, there's still going to be a lot of fear associated with that. And just, getting people on board to come back to work when it is time.
Yeah, I have to say that just earlier this week, I went into the office for the first time in 3 weeks, and it was great to see people. I was like, hey, how's it going? But you have this certain level of stress, this tension that it really caught me by surprise. And I was happy to go into the office to see people, and I left feeling like emotionally heavy that day. And I can only imagine what it would be like for non-essential businesses to start opening back up to say, hey, we got to get money back on the books, come on in, and employees not feeling emotionally ready to do that. I guess the best thing I can say about that is that's going to happen, and it's okay. And it's very important to have open dialogue about that. What is it that you're going to need to feel safe and supported right now? Here's what I can provide you. And to go back to that very first slide that I had about what is it about work that makes us happy? How do we reconnect with that after we've been away from the office for so long?
I heard something too on the radio, kind of puts it in perspective, but people who've been home a lot right now that aren't driving are even fearing their driving skills. They're feeling hesitant getting behind the wheel because they're not driving their car as much as they used to. And I feel like it's the same concept when you're thinking about going back to work when you haven't been working, in the same way. It's just, you're out of your routine, you're not doing your normal thing, and there's just going to be those normal anxieties until you get back into your groove. And I think as employers, we just need to be a little bit more aware of that and a little more sensitive to it. And it can't go on forever. I mean, there's only so much you can kind of handle when you're trying to get your business back up and running. But it's just something we have to put a little bit more sensitivity to, especially in those first, days and weeks as we try to get things back up and running.
All right, we're getting close to time being up here. Is there anything else you two would like to add to the conversation here before we finish up?
Just want to thank you for the opportunity. I thought that this was such a great topic. And as I was researching and Jamie and I were talking about this topic, we kind of learned things about what Riverbend is doing and learned things about ourselves that we didn't anticipate either. So I think it was just a great timing to have this type of webinar.
Yeah, I agree. That's very, very good timing. And Riverbend is available, you know, for individual, but we also do some services for businesses as well. Sarah, did you want to mention like the critical incident type of things real quick before we sign off?
The critical incident, I'm sorry.
Like stress debriefing type services?
Oh, sure. So we actually do some partnering with NAMI as well to make sure that messages about mental health in the community are destigmatized. If you need any help at all with how to message mental health information to your staff or how to get resources out there so they don't feel funny, please let us know. We're happy to do that. NAMI New Hampshire, like I said, is another great resource to be able to vet out resources and to frame it in a way that feels supportive.
That's an amazing resource. You guys are doing so much, and I just want, we'll email this to you all as well, along with the recorded video and the presentation. But Riverbend has a 24/7 emergency line, which, you know, it's amazing that you guys can provide that to our community right now. Very important. Yeah. All right. Well, thank you both so much for this presentation today. I feel like I learned so much, and I'm really glad that everyone could attend today. So thank you all for coming, and I'll follow up with you all via email. Thank you.
Great. Thanks. Bye.